everyone, this is Dr. Saroj Siddiqui from the platform of UKMLA with DSS. Let's just move on to the next lecture of the specialty category, that is the ENT cases or the ear, nose, and throat cases. Okay. So regarding the ENT cases, it can be a bit difficult to deal with the ENT cases because it's a very strong possibility that you may have the ENT case as a combined station. And when it gets into the combined station, you know that the time management can become really difficult. Okay. So you need to make sure that number one, that you're really well versed with the ENT differentials, and you are very well aware of the approach that you need to follow when it comes to the management and when it comes to dealing with the ENT cases. Okay. But there's just another possibility that they may not just give it to you as a combined station. They just may give it to you as a simple history based station. But in both of the cases, in either of the cases, you need to make sure that you are asking directed questions, you are asking focused questions, and your approach is very much differential oriented, because all of the ENT cases, you would have to take the diagnostic approach, and you would have to come to a particular diagnosis and then explain the diagnosis and then manage the condition. Okay. So it's like really necessary that you are well aware then of how to go about it and how to rule out the differences when it comes to the ENT cases. Okay. So the presenting complaint in the ENT, it can be anything. Okay, it can be either pain in the ear, it can be hearing loss, it can be vertigo, or it can be discharge that may be coming from the ear. Okay. So the structure, the ENT structure that we are going to talk about is specifically going to be related to the ear problem. Okay, because the nose and the throat problem are like shows up very rarely. In the nose problem, you may just get sinusitis case, but that also typically presents as headache, and in the throat case, you may just get a case of tonsillitis. Okay, in which there is some throat pain and sore throat. Okay, and in both of those cases, you just need to follow the simple medical history taking approach. Okay, there is no difference, and there is no there's no separate approach for it. Okay. What's separate is basically the approach that you need to take for the ear cases. Okay, and that is why this structure is going to be only the ear focus. Okay. So yeah, the possible presenting complaints in the ear can be either ear pain, or the patient may present to you with hearing loss, or the patient may present to you with vertigo, or the patient may say that okay, there is some abnormal discharge that is coming from my ear. Okay. So based on the symptoms, you're either gonna follow the Socrates or the OD para. Okay. And we all know that what the Socrates and the OD para is. I'm not going to go into the details of it. I've also told you that how to phrase your questions and how to make sure that you word them very appropriately. Okay. What is the most important thing in the ENT or in the ear cases? Okay, is ruling out differentials. Okay, and in most of the hearing cases, and most of the ear cases, you have to rule out all of the differentials that I mentioned over here. Okay, and I'm going to tell you that what are the questions you need to ask and what differences you would be ruling out when you're asking a particular question. Okay, so as you can see that I have mentioned different differentials over here. It can be the Meniere's disease, it can be labyrinthitis, it can be vestibular neuritis, acoustic neuroma, cholesteatoma, otitis media, malignant otitis externa. If there is some somebody is coming to you with a discharge, then if somebody is coming to you with tinnitus, it can be nurse induced. If somebody is coming to you with hearing loss, it can be due to airbags, it can be due to BPPV. Okay, so there are like 8 to 10 different options and different differentials that may be there in ear case. Okay, and how are you going to rule them out? Okay, that is like really important. So let's just go from differential to differential. Okay, and at the same time I'm going to highlight 11 different questions that you may have to ask, that will help you rule out all the differences. So you need to remember these 11 questions. Okay, in some of the cases all of them may be relevant, in some of the cases some of these 11 questions may be relevant. Okay, but you should know what question to ask to rule out what particular type of differential. Okay, Let's suppose that somebody is coming to you with hearing loss. Okay, the next question that you need to ask out to them, that okay, do they have any fullness in the ear? Okay, and if they say yes, then the next question that you need to ask is that do you have any vertigo or any feeling of dizziness, or do you feel that the room is spinning, or do you feel that your head is spinning? Okay, and then the fourth question that you need to ask is about the tinnitus. How are you going to ask that? You're going to ask whether or not they hear any ringing or any bell like sensation in the ear. Okay, so hearing loss is the first question. Okay, fullness is the second question, vertigo is the third question, and tinnitus is the fourth question. Okay, either one of these may be the presenting complaint of the patient. Okay, so you just want to make sure that not you're not repeating it. Okay, let's suppose that somebody is presenting to you with hearing loss, and then again you are asking about hearing loss just to rule out Meniere's disease. That doesn't make sense. Okay, so a patient with Meniere's disease will present with hearing loss, and additionally you can ask about fullness, vertigo, and tinnitus to make sure that this is a Meniere's disease question. Okay, then if somebody presents to you with a hearing loss, okay, and they don't have fullness, they don't have vertigo, they don't have tinnitus, the next question that you're going to ask is that did you have any recent fever or flu like illness? Okay, so if somebody presents to you with hearing loss without any fullness, vertigo, or tinnitus, and they had a recent fever or flu like illness, that means that they are having labyrinthitis. Okay, then let's suppose that if somebody comes to you with hearing loss and additionally they said yes to the vertigo question in the beginning. Okay, and they also said yes to the fever and flu like illness question. That is the fifth question that you asked. Okay, so a patient with hearing loss and vertigo along with the recent flu and recent flu or fever fever or flu like illness, that means that this patient is having something called the vestibular neuritis. Okay, labyrinthitis and vestibular neuritis, both of them are self-limiting conditions, so they just need reassurance. Meniere's disease is, however, a long-term and a lifelong condition, and it requires certain, medications like prochlorperazine, and you need to make sure that you give them the correct advices, and you give them the right psychosocial support because of tinnitus. Okay, and you make a referral to the ENT as well. Okay, so yeah, one thing you don't ask, you're gonna miss out the differential. Okay, and the self-limiting condition may just become a lifelong condition. Okay, so you make sure that you're well versed with these questions, and you ask them every time you're dealing with the ENT cases or the air cases. Okay, then the next important question is basically facial nerve weakness. Okay, so somebody presenting to you with hearing loss, okay, and they also have facial nerve weakness. Okay, it means that the patient is having acoustic neuroma. So the patient of acoustic neuroma, they would present with hearing loss. They would say no to fullness. They would say no to vertigo. They would say no to tinnitus. They would say no to fever and flu-like illness. But once you ask that by any chance do you have any facial nerve weakness, they're going to say yes, doctor. I do feel that my like face is my muscles are getting weak, and I'm having some issues in smiling and some issues in making facial expressions. Okay, so this is the sixth question that you're going to ask. Okay, then a patient of hearing loss, uh, if he says no to all the other questions, fullness, vertigo, tinnitus, fever, flu like illness, and facial nerve weakness, the next question, the seventh question that you need to ask is basically, by any chance are you having any discharge? Yes, doctor. Is the discharge painless? Yes, doctor. Is the discharge foul smelling? Yes, doctor. Okay, so there is a reason why I have mentioned seven over here, because you're done with the hearing loss thing and now you're moving on to another symptom, that is the discharge. Okay, which may be one of the presenting complaints. Okay, so if the patient is coming to you with the discharge, okay, even then you would have to follow the same approach. Ask about hearing loss, ask about fullness, ask about vertigo, tinnitus, fever and flu like illness. Okay, facial nerve weakness. Okay, so make sure that you are asking all of these questions. Okay, So if the patient is having foul smelling, painless discharge, then you know that it's cholesteatoma. Okay. Then you have asked about the discharge. Now otitis media. In the otitis media patient, the patient will also have a hearing loss. Okay. The patient will have a discharge as well. Okay, but this time the discharge would be painful. Okay, instead of a painless discharge, the discharge would be painful. Okay, but along with painful discharge, the patient will also have fever. Okay, so that is the eighth question that you need to ask, that do you have any fever? Okay, if the patient is having fever and the patient is having a discharge which is painful and there is hearing loss as well, then otitis media is something that should come to your head. Okay, then somebody presenting with hearing loss, painful discharge. Okay, till here you are going to think about otitis media, but and the patient may also just have fever as well. Okay, so till here you are going to think about, question number 8. You are going to think about otitis media, but the moment you ask the ninth question, that by any chance are you having any medical condition that I should be aware of, and if the patient says that yes doctor, I have HIV, I have diabetes, okay, then you may think about malignant otitis externa, because it presents with painful discharge, hearing loss in an immunocompromised individual. Okay, so this ninth question becomes like really, really important. Okay, then noise induced. If the patient is presenting with hearing loss and tinnitus, okay, and there is no fullness, there is no vertigo, there is no fever or flu-like illness, or there is no facial nerve weakness, there is no discharge, there is no fever, and the patient is also not immunocompromised. Okay, then you're going to ask about the occupation, that by any chance do you work in a noisy environment, or can you please tell me the nature of your work? And they're going to say that yes doctor, I work at a factory, yes doctor, I work as a in a in an orchestra. Okay, wherever there is a noisy environment, or I work at a tractor factory. Okay, I work near heavy machinery. Okay, so now you would know that okay, this patient is having hearing loss and tinnitus with a noisy occupation. This means that the patient is having a noise induced hearing loss. Okay, then if a patient is having hearing loss with fullness, okay, and with pain in the ear, okay, as you can see that this is one of the symptoms. Okay, you may think about the differentials of the airbags. Okay, airbags may be present. Okay, then if the patient is presenting with just vertigo, okay, if just vertigo is the presenting complaint, okay, there is no hearing loss, there is no fullness, there is no tinnitus. Okay, and neither there is any recent flu-like illness that the patient may have had. Okay, then you're going to ask the 11th question, that is this vertigo dependent on the movement of your head? Okay, and if that is the case, then that means that this patient is having BPPV. Okay, benign paroxysmal positional vertigo. Okay, so you see just these 11 questions. Okay, you need to be well aware of these 11 questions and identify one thing. In most of the ear cases, the patient is having hearing loss. Just have a look at this. Meniere's disease, hearing loss is present. Labyrinthitis, hearing loss is present. Vestibular neuritis, hearing loss is present. Acoustic neuroma, hearing loss is present. Okay. Cholesteatoma, hearing loss is there. Otitis media, hearing loss is there. Malignant otitis externa, there is hearing loss. Noise induced, hearing loss. Airbags, hearing loss. Okay, it's just the BPPV in which there is no hearing loss. Okay, so hearing loss is going to be the most common presenting complaint to you in when it comes to the ear history. Okay, and then all of those things, all of the differences would revolve around the hearing loss. Okay, and that is why hearing loss is the very first question that you need to ask, no matter what other differential no matter what other symptoms comes as presenting complaint. Okay, after you're done with the Socrates and the OD para, ask these 11 questions. Okay, I'll just quickly repeat it. By any chance, are you having any hearing loss? Do you have any fullness in the air? Any vertigo or any dizziness? Or do you feel that your head is spinning? Do you feel that the room is spinning? Tinnitus, do you constantly hear any abnormal sound in the air? Have you had any recent fever or flu-like illness? By any chance, are you having any weakness in the muscles of your face? Are you having problems in smiling? Are you having problems in giving facial expressions? Okay. By any chance, are you having any discharge from the air? Okay, and then along with the facial weakness, okay, or along with the hearing loss. Okay, so you would know that this is cholesteatoma. Then, if the patient says that yes, doctor, I am having a discharge, is the discharge painless or is the discharge painful? Okay, then you're going to ask about the fever, that by any chance are you running any fever? Okay, and then after the fever, you're going to ask about by any chance do you have any medical condition that I should be aware of, like diabetes mellitus, HIV. Okay, or by any chance you might have had any organ transplant in the past that I should be aware of. So you're going to touch upon the immunocompromised individuals. And if you don't find anything else over here, anything useful, and still the patient is having hearing loss and tinnitus, then you're going to ask about the noisy occupation. Can you please tell me the nature of your work? And if anything is not there and it's just what I go, okay, and the answer to hearing loss, fullness, tinnitus, fever, flu-like illness, discharge, immunocompromised status, noisy occupation is all no, then you're going to ask about the uh, increase in what I go on, movement of the head. Okay, so just these 11 to 12 questions that you need to remember. Okay, and if you are well versed and if you are well aware of these 11 to 12 questions, then there is no ear differential that you're going to miss. Okay, it's a very unlikely that you are going to miss out on any diagnosis in the exam when it comes to the ear cases. Okay, so make sure that you have it there in your head. You make sure that you are very well versed with this 11 to 12 different questions. Okay, and why I have made it so simple and why I have just given you this particular approach of asking these 11 12 questions in this particular order, because it is going to save up a lot of time. Okay, these 11 questions are going to take like hardly 2.5 minutes. Okay, maximum 2.5 minutes to ask, and just by asking these questions, you would be able to get to the diagnosis, and you will have enough time to do the examination as well in case it comes as a combined session tool. Okay, one important thing that I would like to share and I would like to show, because I have mentioned it in some brackets over here, that what are the examination findings that you may get, okay, in a particular diagnosis. Like for example, in cholesteatoma case, there would be the presence of pars flaccida that would be visible on otoscopy. Okay, you need to remember this thing, you need to be aware of this thing, that how it looks. Go and google it, that how it looks on otoscopy and what are the otoscopic findings of cholesteatoma. Okay, then in the otitis media case, once you offer the examination, okay, you are going to see a ruptured tympanic membrane that would be visible on otoscope. Again, just google it and see as many pictures of ruptured tympanic membrane that are seen on otoscopy. Okay, really important. Then one very important thing, one very important thing. Okay, uh, there are a few cases in which, even though it would seem as if they are a combined station, but you would not be able to do the examination. Why? Because the patient would be in so much pain, and with so much pain that the patient would not let you touch the ear. Okay, and whenever you say and whenever you begin your examination and you say that okay, I would like to have a look at your ear and I would like to perform an examination using this equipment called the otoscope. For this purpose, I would have to come near to your ear, and I would have to touch your ear, feel it, and also have a look inside the ear as well. Will that be okay? And then they'll give you the consent that yeah, doctor, fine, just do whatever you want to. Okay, and the moment when you hold the ear to inspect, and the moment you bend the ear to inspect the posterior side of the ear, the patient is going to shout in pain. Okay, and most likely this is going to happen in the case of otitis, malignant otitis externa. Okay, so make sure that you don't just force your examination, because if the patient is shouting in the pain, okay, it means that the examiner is trying to test your ethics, and it's basically trying to test your IPS, that whether or not you are able to stop your investigation and stop your examination, because the patient is in pain, or you're just being a non-empathetic doctor who doesn't care about the pain that the patient is going through, and you just all you care about is getting your examination done. Okay, so you need to make sure that you don't perform and you stop the examination right then and there, and you just say that, okay, Mr. Adam, I can see that you are in a lot of pain, and it would be difficult for me to examine you right now. So what I'll do is I'll just ask a couple of more questions to get a better idea of your condition, and later on give you some painkillers and make sure that once your pain is subsided and once you're comfortable enough, then I can examine you. So the moment you say that, then there are two possibilities. That number one, either the examiner or the simulator would just give you the examination findings, or they may just say that, yeah, doctor, I'm just fine now. Thank you for being so considerate. Now you can examine me. Okay, but you always need to make sure that you put your ethical values first, before you're the pressure of just examining the patient. Okay, so really important. Another thing uh, is basically the Dix Hell pipe test and the Epley's maneuver. Okay, a lot of people in the BPPV case, they often miss out on this and they don't say this Dix Hell pipe test and the Epley's maneuver. Epley's maneuver is basically said in the management part, and the Dix Hell pipe test is basically offered in the examination part. Okay, so why am I highlighting this? Because in the examination part, people miss out on this because they're so concerned about otoscopy that they completely forget to mention this. So in the vertigo case, that is secondary to the BPPV. Okay, you have to perform the otoscopic examination. You would not find anything. Okay, there wouldn't be any positive finding. But after you are done with the otoscopy, then you need to at least verbalize the Dexel pipe test. Okay, that is the gold standard test for diagnosing BPPV. Okay, and if you don't do that, then don't expect to get high marks in your data gathering, and don't expect to score high in the station. Okay, because it's a very very important test that you may just miss, and your data gathering and your eventually your management would also get compromised. Okay, so yeah, then comes the P-Maftosa part, the past medical history, medicines, allergies. Okay, allergies may be important in sinusitis case. Okay, in which you're dealing with nose-related issues. Uh, Other than that, travel history may be important. Some people may develop some ear infections after travel. Then psychosocial aspect is like also very very important, because people with vertigo specifically, and people with tinnitus, they need psychosocial support, because a vertigo patient would be keep on just falling, bumping their heads. Okay, so they would want to have some support, some family members there to support them, make sure that they don't fall, make sure that at work people are there to ensure that they are safe. Okay, and the psychosocial aspect would be important in case of tinnitus, because the patient who have tinnitus, they have severe mental health issues as well, because it's not easy and it's not really comfortable that a bell is constantly being ringing in your ears, and it keeps on disturbing you. So these people struggle with mental health issues as well. So just need to ask about the psychosocial aspect, and that how has this condition affected your well-being in general. Okay, important thing. Other than that, in anything else, the driving and occupation, this is something that I want to talk about. Many people who are having hearing loss, okay, and vertigo, okay, it's not very safe for them to drive, because somebody, if they have the hearing loss, okay, and if somebody is beeping the horn, they would not understand, and they may not be able to hear the horn and take the necessary precautions, braking or changing the lane. Okay, so driving may become difficult for the people with hearing losses. Okay, number one. And number two, the patient with vertigo, they may have difficulty in assessing the road condition, they may have difficulty in assessing the car that might be coming in front of them. Okay, because their head may be spinning, so their road would also be spinning in front of their eyes. So it's not particularly safe for the people with hearing loss and vertigo to drive. Okay, and so and same goes for the tinnitus as well, because if a constant sound is being ringing in the head, then the patient may just get distracted, and the chances of accidents may just increase. Okay, so always ask about driving, and always make sure that in your management section you give the driving advices that they're not supposed to drive, or they have to inform DVLA. Okay, then number two, the occupation is like really important. Number one, because maybe the condition is because of the occupation, like for example the noise induced hearing loss and tinnitus. Okay, it may be because of the occupation. So you need to ask about the occupation, and you need to stop that person from doing that particular work. And secondly, the patients who have vertigo, uh, and if they are working at heights, okay, uh, like a scaffolder, okay, or somebody working on the mountains, okay, or somebody construction worker working on a very top floor, or a painter that is working on a very top floor. Okay, these patients, they are supposed to stop working at heights, because the height can further trigger their vertigo. Okay, and if they're working at heights, it may be very dangerous for them, because they may just get a vertigo episode, and they may just fall down from height. Okay, and they may just harm themselves. Okay, so it's very important to ask about the occupation, and give the relevant advices. All right. So yeah, this is what the structure for ENT differentials was, and the ear cases. Okay, so make sure that you have these 11 to 12 questions written down, and make sure that you are able to rule out all the differences, because as I said, just the presenting complaint will not help you come to a diagnosis unless you ask about all these differentials. And since the symptoms are so overlapping, it kind of gets difficult to identify that, okay, what is the case, and what might be the diagnosis. Okay, because of the overlapping symptoms, because of the non-specific symptoms. Okay, but if you follow this approach, and if you ask these 11 questions in the correct order, okay, the correct order is also really important. In the correct order, then I'm pretty sure that you would be able to come to the diagnosis most of the times. Okay, so that's pretty much it for the ear structure and the ENT cases approach that you need to take. If you've got any questions and any queries regarding this, then drop them down in the comment box below, or reach out to our social media. I'm going to address any question and any concern that might pop up there. Okay, so that's it from my side. See you in the next lecture.